Fighting Blindness Canada's Viewpoint is a virtual education series that brings you the latest in vision research presented by health experts from across Canada. The webinar you're about to watch is a recording. To learn more about the research we fund and upcoming webinars and events, please visit our website at fightingblindness.ca. This Viewpoint webinar is proudly presented by Bayer and supported by Allergan, Biogen, Janssen, and Novartis. We'd also like to thank Accessible Media Inc., our national accessibility partner. Everyone here should download the AMI app, which is a fabulous resource. And you can watch excellent programming, including previous Fighting Blindness Canada events. Thank you for watching. We hope you enjoy this webinar and share your thoughts with us in the comment section below. Let's just dive in. Are you ready, Larissa?
Ready. It's going to feels like a bit of a lightning round. Try to get to as many as possible.
Exactly. All right. So our first questions come in from Barbara. And Barbara says she has retinitis pigmentosa and Usher syndrome. And she has been advocating with us at Fighting Blindness Canada by sharing with her network to approve the new drug called Luxterna. Thank you so much, Barbara. That work is so important right now. And her question is, will Luxterna help her specifically? She says she only has light perception, and she's wondering if this treatment could offer her sort of any hope. And she says she's also in, I believe, the patient registry. She's had her genetic testing done as well.
That's a great question. It touches on so many things that Fighting Blindness Canada is really passionate about. So first of all, I want to say thank you, Barbara, for sort of stepping up and lending us your voice. And for people who don't know, with the support of the community, including people like Barbara, Fighting Blindness Canada has been advocating to get the gene therapy Luxterna, which is the first gene therapy for an eye disease. And we're really advocating for it to become available to Canadians. So this was approved by Health Canada in 2020, and it's taken over a year, but finally in the last few weeks, we have heard that the provinces have agreed to start the price negotiation. So it's taken a long time, but the negotiations are starting. And then at the end of the price negotiation, there will be one final hurdle where the provinces have to decide if they will actually publicly fund it. But we know that we need to keep the pressure on, because for Canadians who could access Luxterna, every day that goes by is another day that they are losing a little bit of vision without having access to treatment, which is available in many countries around the world. And we also think it's really important for individuals with not only other inherited retinal diseases, but any other individual with an eye disease for which there is an innovative treatment that is being tested. Because if we can't get Luxterna approved, what are the chances that some of these other treatments will come to market? So please help us out by going to approveluxterna.ca, and Morgan will share the link later. And please send a letter to your premier to keep the pressure on and let them know that it's really important that this amazing therapy gets funded. But to get specifically to Barbara's question, that was a bit of a soapbox there. So Barbara is asking if Luxterna will help her, and she has got retinitis pigmentosa, potentially Usher's, and she only has light perception. So first of all, I would say that Luxterna is very specifically for individuals who have mutations in a specific gene called RPE65, and the individual has to have mutations in both of the copies of their gene. And they would, in that case, have either retinitis pigmentosa or Leber congenital amaurosis. Now, the slightly complicated thing is that over 60 genes cause retinitis pigmentosa. So if you have a mutation in a different gene, unfortunately, Luxterna will not work for you. There might be some other gene therapies in clinical trials right now, or other therapies, which we'll talk about, but Luxterna is very specific for individuals with the RPE65 gene mutation. Also, in terms of if you only have light perception now, will it work for me if you do have the gene mutations? I can't answer that question. That is really a question for a doctor. CADIT hasn't put any specific limitations on who can get access to the treatment, but they do say that the patient has to have, the wording is sufficient viable retinal cells. And they acknowledge that it is a very complicated definition. It's not very clear what it means. And basically your inherited retinal disease specialist or your IRD specialist is the person who will determine if somebody has sufficient viable retinal cells. Because if you don't have enough retinal cells surviving, then the gene therapy just won't be that effective. So overall, it is likely to work a bit better in someone who has a few more cells available. So I hope that answers your question. From what you have said, it does not sound like this treatment will be for you, but again, I don't know your specific gene mutation, so I can't tell you for sure.
Absolutely. And that's why it's so important, you know, to get the approval so that younger people who are, because the treatment would be more effective. Obviously, the younger you are, the more viable cells that you have remaining. So getting younger people the treatment is very important, but it's also a precedent setting treatment. So, you know, there are more down the line, and we're going to talk a little bit about that later today, what other treatments are coming that might be helpful.
And I would also just want to say, Morgan, like we often do say, like for younger people, and I might have said that as well, but the important thing really is the number of viable cells. So if you are in your 40s, your 50s, your 60s, and you still have good viable cells, this treatment could still work. And I know in the clinical trials, they tested the treatment out on individuals of very many different ages, and there were effects in all of them. So there isn't an age cutoff, which I think some people can get a bit nervous about that, the idea that they're getting older. So it's not really about the age per se.
Absolutely. Thank you. Yeah, that's a very important clarification for sure. We also opened up questions on social media. So we've had a bunch of different social questions come in that way. So we had a question about an anti-VEGF drug called Lucentis. And someone was wondering, is there any new information regarding the use of anti-VEGF treatments during pregnancy?
Yeah, this was a really interesting question. And I actually reached out to a doctor about this because I wanted to make sure I was getting the right information. So I think the person who's asking the question, it was sort of general to anti-VEGF treatments, not specific to the specific type of drug. So for individuals who don't know, anti-VEGF are used to treat eye diseases like wet age-related macular degeneration, diabetic macular edema, and then other types of usually more rare types of choroidal neovascularization, where there's uncontrolled blood vessel growth in the retina. And this can lead to leakage and fluid leaking into the eye, which can cause vision loss. So the way anti-VEGFs work is they block the growth of blood vessels by blocking the activity of a specific molecule called VEGF, and VEGF stands for vascular endothelial growth factor. So as you can imagine, so blood vessels are important everywhere. They're important in your eye, and if they grow too much, there are problems. But they also are extremely important, and VEGF is really important during pregnancy and for the growth and development of the baby. So there are concerns that if you're taking anti-VEGF, even if the injections are in the eye, if the drugs go around the body, they could interfere with the pregnancy, with the health of the growing child. So when I reached out to a retinal specialist about this, their response was that currently, and sort of unfortunately, there still isn't enough safety data to support using anti-VEGF treatments during pregnancy as a regular treatment. So they mentioned that for some individuals, they might need only 1 or 2 injections. For instance, if they have a rare type of disease like myopic choroidal neovascularization or other types of rare CNV. But then it's usually only 1 or 2 injections at the most, and then it's over. But for someone who has, for instance, diabetic retinopathy or DME, so diabetic-related eye diseases, as a doctor, they would always change their patient over to a different type of treatment, such as a steroid injection or pellets or using laser treatments, all of which are safe, not only during pregnancy, but also during nursing. So I think the answer is currently we still need more information. There isn't clear information, so doctors tend to stay away from using anti-VEGF unless it's sort of a very critical or only 1 or 2 times.
Thank you. That's very interesting. It's not something that I would have thought of because, of course, I associate necessarily anti-VEGF with age-related macular degeneration. So I don't necessarily think about pregnancy, but of course, these drugs are also used in people who have diabetes and other forms of macular degeneration as well. We had another question here from Amini. Amini's asking, are there any new research about a cure for congenital glaucoma or about the optic nerve cupping that can be associated with glaucoma?
Right. So congenital glaucoma is a very rare form of glaucoma. It's known as childhood glaucoma, and it occurs in babies, it occurs in young children. It also leads to increased intraocular pressure, which can lead to damage to the optic nerve and vision loss. So in terms of research, so yes, there is research happening. However, in terms of treatments and cures, from what I could see, most of the treatments and cures were drops, different types of surgery, but also trying to improve those treatments. A lot of it will depend on what the underlying cause is. And there currently isn't a lot of information about what the causes of congenital glaucoma are. There have been some genes that have been identified, and mutations, multiple types of mutations have been found in these genes, but for many individuals, it's unknown what the cause is. And so there is definitely research happening looking at sort of the underlying cause, whether it's a specific one gene or maybe multiple genes or multiple tissue processes that aren't working properly. And there is international research happening. I found something called the Childhood Glaucoma Research Network, which is an international organization. It's composed of researchers from, they said, over 80 countries working together to do natural history studies and understand more about congenital glaucoma. And yeah, so there is some research happening, but nothing that I could see that was a new treatment specifically for congenital glaucoma compared to treatments that would be used for other types of glaucoma.
That's interesting. And we often get questions about how researchers work together. And I love that idea of this sort of network of people that are working together on the same condition. Wishing them luck as they continue to work together. We have another question here that came in by email from Mary Kate. So she said, I often see best corrected visual acuity, sometimes abbreviated as BCVA, as the primary measurement of success for retinitis pigmentosa trials. And she's wondering, why is this the case? If there were potential therapies that could improve other clinical indicators, so for example, visual field or mobility in low light situations, but did not show significant improvement to BCVA, would they still be valid trials?
Okay, I thought this was a really interesting question. And the short answer is yes, they would still be valid trials, but to give you a bit of a longer answer, because that's what I'm here for. So best corrected visual acuity, it's one of the, well, not the main way, but a very common way to test for vision. So that is if you go to the eye doctor and they say your vision is 2200 or 2020 or 2060, that is measuring visual acuity. And it's primarily measuring central vision. So how clear is your central vision? How sharp is your central vision? And so for some eye diseases, this is a really appropriate measure. So for instance, we were talking about anti-VEGF treatments where loss of central vision, say age-related macular degeneration, is one of the first causes of vision loss. So in that case, looking at BCVA or visual acuity is a very appropriate measure. For a lot of inherited retinal diseases, and Mary Kate mentioned retinitis pigmentosa, this might not be. She's right, because some of the early types of vision loss are in night vision and some peripheral vision loss, where central vision maybe gets lost later in the disease. So you might have a treatment that can correct the peripheral vision, but you're never going to see a difference in BCVA. So it won't be a very useful measure, because you might get improvements in vision, but it won't be able to be measured. So actually, a lot of scientists do know this. And so for a lot of clinical trials that are happening now, their primary outcome measure is not BCVA. So for instance, Luxterna, which we talked about before, which is the first gene therapy that was approved, their primary outcome was actually the ability of somebody who was treated to navigate a maze under different light conditions. So they had the maze, they had in different conformations, they had different lights. It was a whole very technical thing, but that was actually the primary outcome. And so if you go onto clinicaltrials.gov, which is a major database where all clinical trials that are good are listed, or then you can see a lot of information about the clinical trials, but one of the things they always list is what are the primary outcomes and what are the secondary outcomes. And they decide this before the trial even starts. So you're not allowed to start a trial and say, we're going to look at BCVA and then say, oh, we didn't see an impact here, so instead we're going to look at this mobility maze instead, and then we'll just pretend that it worked. The researchers really do a lot of work to figure out what is going to be the best outcome and where are they going to see a potential difference that is meaningful. So I looked through a number of clinical trials for inherited retinal diseases, and BCVA is sometimes the outcome, but other outcomes can be safety in early phase clinical trials, mobility course, pupil response to light, even quality of life. So lots of different outcomes that are all sort of specified is the word. And this sort of gets me to why natural history studies are actually really important, is you often do a natural history study before you start a clinical trial. And the natural history study is gathering information about how vision progresses over time, and is it decreasing, what is decreasing, what are the measures you use, and this is actually really important to figure out which outcomes are meaningful. So for instance, as I mentioned, if someone's peripheral vision is reducing, but the visual acuity isn't changing, then the researchers will know, okay, actually we need to measure something that is measuring either peripheral vision or functional vision, but not necessarily BCVA.
Great, thank you, Larissa. That was interesting. I know, like you said, with the Luxterna trials, one of the things they did was the obstacle course, and I've seen some like videos of that. It's very interesting how they use those types of things to measure outcomes as well. So I'm going to take a pause right now from just the questions that are coming in. I see a lot of questions in the Q&A that actually might be answered, or partially answered at least, by our next segment here. So before I play our video, Larissa, this week we had our e-news came out yesterday, and we had a very exciting announcement. Would you like to tell us a little bit about that before we show the video?
Yeah, absolutely. So the announcement was that we awarded the second phase of funding for this research program called Restore Vision 2020 to Drs. David Gamm and Dr. William Beltran, who are working together on a new type of cell replacement therapy for late-stage retinal degeneration, in particular late-stage retinitis pigmentosa. So this is a really exciting research program we have. It's called Restore Vision 2020. It was established in 2018. And it came from a generous donation of $2.5 million from Donna Green, her mother Goldie Feldman, and an anonymous donor. And the aim of the program was to support the development of therapies for late-stage retinal degeneration, with a particular focus, as I mentioned, on RP, or retinitis pigmentosa. So back in 2018, 2019, we held the first phase of competitions and awarded $1.25 million to 4 different researchers. And they've all been working really hard on 4 different potential therapies. And then this last year, we asked the researchers to put in applications for 2 more years of funding, up to $725,000. And the researchers did, and Dr. David Gamm and Dr. Beltran's proposal was deemed the strongest proposal. They have made amazing progress over the past 2 years, even despite COVID, and just are sort of at the cusp of some really exciting results, trying to see if this new potential cell replacement therapy is going to improve vision, and they're looking at a canine model in their thing. And so the hope is that based on these results, as well as it's going to take up a couple more years, but that if successful, this could lead to a clinical trial. So we're so excited to be supporting their project for another 2 years. And I'm really excited to hear the interview. I helped do the interview, but I haven't listened to it back, so I'm excited to hear what they're going to say again.
Excellent. Well, I will play that for all of us to watch in just a moment. So Dr. David Gamm, just so we know, is the professor of ophthalmology and visual sciences at the University of Wisconsin. And he is also the RRF Emmett A. Humble Distinguished Director of the McPherson Eye Research Institute. And he'll be joined also by Dr. William Beltran, who's a professor of ophthalmology in the Department of Veterinary Medicine at the University of Pennsylvania, and the director of the Division of Experimental Retinal Therapy. My goodness, that is a mouthful. So we're going to just watch this video, and then we'll come back and answer some more questions. But hopefully this will help address some of the questions that I have seen coming in through the chat. Let me just see here. Is that visible, Larissa, the video right now?
It was, and he just went away.
Oh, okay. Sorry. One small technical difficulty. Let's get this up. I just want to make sure we have sound as well.
Welcome, Dr. Beltran and Dr. Gamm. We're so excited to have you here. And I first of all wanted to say congratulations for being awarded a second phase of funding for the Restore Vision 2020 competition. We're so pleased to have supported your work and excited to see what else is going to be coming.
Thank you very much, Larissa. We're thrilled to be able to continue to work with Fighting Blindness Canada and on this project. It's exciting for us.
I know our audience is going to be really excited to hear more from you guys. I'm just going to jump right into some of the questions. And I thought, first of all, I know you're working on cell replacement therapy. I was wondering if you could briefly describe this specific project, this FVC funded project. I'll
Sure.
turn over to Dave. Dr. Gamm first.
Yeah, so sure. So this is obviously a multi-institutional project that brings in expertise and skill sets from a lot of different laboratories and entities in North America. So from my standpoint, what we're trying to do is take our ability to make pluripotent stem cell derived photoreceptors. So the rods and the cones that are important for initiating vision and that are lost in many forms of inherited retinal degenerative disease, including retinitis pigmentosa. And so part of this was building off of our ability to make those cells in large quantities with high quality and retaining the properties necessary to perform those functions in a human once they've been placed into a patient with disease. However, even though we're able to make those cell types, getting them to be properly installed and learning how to do that in the most efficient and safe manner, and then to determine whether they are in fact functionally replacing the cells that have been lost in patients is a very tall order. So what phase 1 allowed us to do is initiate that effort to build out our ability to make the cell types, the photoreceptors, to treat patients, and then establish this wonderful relationship with the University of Pennsylvania and William Beltran's group to test that in a very, very relevant animal model. And so that's what we worked on so diligently in phase 1. And we've made progress such that we're very pleased that we've been accepted for phase 2 funding as well, which will take us to the next step in those studies.
That's wonderful. And either Dr. Gamm or Dr. Beltran, do you want to discuss what are some of the actual experiments or steps that you'll be doing in the phase 2 of the study to advance this work?
Sure. So we've been, in fact, delighted to join this group and this consortium with David Gamm's group because what we've been working for over 20 years at developing gene therapies for inherited retinal diseases using dogs that have naturally occurring mutations. And what we've seen is that there is basically a finite time window for a gene therapy intervention. And obviously what this project brings is the possibility of having a therapy for end-stage retinal diseases. And that's something that we were able to test and validate in several of our dog models of retinitis pigmentosa. So some of the work that we've done in the phase 1 was to first try and optimize the surgical delivery of these cells. We've been injecting viral vectors for 20 years. Injecting cells is slightly different. You have to accommodate the size of the cells, make sure that they survive, be able to image them. And also because we are injecting again the human cells, the goal is to treat obviously human patients. We're injecting human cells in a dog retina. We've had to identify a protocol, immunosuppressive protocol that allows the survival of those cells. So what we're really going to be looking at now during this phase 2, now that we know how to deliver, we know how to image, we know that these cells are surviving, is how well, in fact, they integrate. How well do these photoreceptor cells that are human mature into adult photoreceptor cells, and then establish synapses. And you can think about synapses as a cell shaking a hand with another cell. And that is basically what everyone is trying to demonstrate, is whether or not they are indeed exchanging the information, passing the information that they're able to collect to the other cells in the retina. So we have different ways of assessing this function. One is by doing what's called an electroretinogram, which is a bit like is to the retina what an EKG is to the heart. And we have a collaboration with Jeffrey Aguirre, who's a neurologist at the School of Medicine at Penn. we have the ability, in fact, to do a functional MRI, so to look at what's happening, in fact, in the visual cortex of the brain, and picking up whether or not, following the injection of these cells, we basically see any signal that is appearing.
It's so interesting hearing both you and Dr. Gamm talk about the process to develop this therapy. So it's really the sort of the industrial scale process of making the cells, and then how the cells oriented and making sure the injections work. So many different unique steps in there. I was wondering if you could also, you sort of have touched on this, about the idea that this treatment, you're currently looking at late stage retinitis pigmentosa, but would this treatment in the future potentially be useful for other types of either inherited retinal diseases or other types of retinal degeneration beyond retinitis pigmentosa?
So yes, and one of the great things about this is that it's relatively agnostic towards the cause of the photoreceptor loss. So there's a lot of different things, both diseases and injuries, some of which are retinitis pigmentosa or RP-like disorders. But some of them are also disorders that we don't really understand the genetics of yet, but that lead to loss of cones and rods. And then there are injuries and other events that can occur that are quite common. Think of retinal detachments. And so when the retina detaches, and if it's not able to be replaced in time, then photoreceptors can be lost in those diseases as well. There are other types of injuries that we're looking into, and basically the product that we're making would be relatively the same for all of those. And one thing for this particular phase 2 project that will help in that regard is that we're also testing not just introduction of the cells by themselves, but also the cells incorporated into a patch or a scaffold. Which will presumably, and in our preliminary studies, help to orient them and also restrict where we deliver them. So when you inject cells, just like if you inject anything, we can't necessarily dictate where they go. But if they're in a prefabricated, biodegradable, which means it dissolves on its own, scaffold, then we can better place where they're at and hopefully orient them to. What it also allows us to do is in the future, think about building more complex sandwiches. So if there are other cell types in addition to the photoreceptors that have been injured or lost in the course of disease, then we can think about that as well, such as retinal pigment epithelial cells. And so if you now look at the combination of photoreceptors and RPE cells, which are the helper cells for the rods and the cones, that opens you up to macular degeneration, Best disease, Stargardt disease, so other types of diseases and injuries that affect a great number of individuals around the world. So that's another exciting aspect of this particular project that we think not only allows us to test kind of our 1.0 approach, but also look ahead to a 2.0 approach that can help even more individuals.
I'm glad you brought that up. I've actually had a question from a community member before about, could multiple types of cells be transplanted in a stem cell or a cell replacement therapy? And my answer was, well, currently right now we're not really doing it, but I think you've answered that perfectly about how using some of these more innovative models like the microscaffold, you might be able to in the future build more complex types of cell transplantation models.
Well, I mean, we're actually pursuing these avenues right now, but they are more complex, and so they're going to be behind the more straightforward single product, single cell replacement approaches. So it adds additional complexity and difficulty from on many levels, both the manufacturing standpoint as well as the testing standpoint. But the beauty of this of our phase 2 project is we'll be in an excellent position to test those products too with the infrastructure that we're setting up between the University of Wisconsin and the University of Pennsylvania.
Absolutely. Dr. Beltran, I have a question for you that you touched on a little bit when you were talking about how you have a lot of experience or historical experience working with gene replacement therapies and now moving into stem cells, which potentially are more universal. Can you maybe elaborate a little bit on what the benefits are of a cell replacement therapy versus other types of treatments that are currently in the market for inherited retinal diseases or other types of retinal degeneration?
Yeah, so it's a question of time window and phase of disease. Gene therapies have been developed so far with the understanding that the cells, in particular the photoreceptor cells or the retinal pigment epithelium, are still around to be able to rescue them by introducing in them maybe the missing gene. In the case here of this stem cell therapy approach, the goal is to be able to restore vision when there are no longer any photoreceptor cells potentially left. So we're targeting patients for which there is basically no hope that gene therapy would be effective. So end stage degeneration. I think that what another I would say advantage of the stem cell therapy there in comparison to, for example, an approach called optogenetic that is actually in clinical trials right now, is that by introducing, in fact, new photoreceptor cells in the retina, you're reconstituting the connection, the wiring of the normal retina versus optogenetic strategies that are aimed at rendering second order neurons or retinal ganglion cells, which are down the line, photosensitive. So ultimately the hope is that because the retina plays a role already in the pre-processing of what's going to become an image in the brain, that the quality of the visual restoration might be higher with a stem cell therapy approach than targeting downstream, for example, retinal ganglion cells by optogenetic approaches.
That's great. Dr. Gamm, do you have anything that you want to add to that answer about maybe what makes you excited about pursuing cell replacement therapies?
William covered it very, very well. I think that I oftentimes field questions from individuals, and everyone has their own story. There's no two people are alike. Even if you have the same gene that has a mutation, if we're talking about inherited diseases, everyone's course is different. So are they early in the course? Are they towards the end of their course? And sometimes it's disconcerting to folks because they ask, well, what's being done for me? And the amount of time, effort, and finances that is required to bring any therapeutic product or to market or to a patient is so high, and the time frame is so long that if we had to do this for thousands of individuals at a time separately, it would be really prohibitive. And so the opportunities to develop therapies that are more broad-based is really helpful for me, because then I can field these questions and I feel a little bit better about saying, yeah, no, I do foresee what we're doing as being potentially helpful for you if you reach a certain stage. Again, but it's not a silver bullet. That's important to understand too, that this is not a cures what ails you for everybody. There really is no therapy for any disease. There really is just that kind of magic bullet. But hopefully this one will have a large catch basin for patients, and will help those that otherwise don't have other places to turn.
Yeah, absolutely. And one of the things that I like about actually both of your answers is the idea that there actually are so many different types of potential therapies and treatments that are in research right now. It's a pretty exciting time. So it's nice to sort of be able to say this one is better, where maybe 10, 15 years ago, there wasn't even the option of talking about any therapies. And now we can sort of start to parse and say, well, for one person, a gene therapy might be useful, but then if the disease is advanced, or maybe looking to the future, cell therapy or optogenetics could be a really exciting option as well.
Oh yeah, as a consumer, you want all those options, right? I mean, they're all, and that's important for us too. This is by in no means competitive. We hope we have 3, 4, 5 things you can pull off the shelf during your lifetime that says, okay, well, Ms. Jones, you're at this stage. This is what your retina looks like. This is what your risk-benefit ratio is, and so we think this is better for you. Just like you might treat somebody with arthritis at different stages of their disease, right? So that the goal here is to have lots of different arrows in the quiver. And considering where we were a decade or so ago, where we had potentially no arrows in that quiver, I think it's an exciting time.
For sure. The last question I'm going to field to both of you actually is if you could maybe discuss some of the challenges that are in the field of cell replacement right now, and maybe your treatment will be addressing that, or are there just like large challenges that you sort of think that the field has to overcome to really bring a successful stem cell treatment to market? So maybe I'll start with Dr. Beltran.
Yeah, so I think we talked a little bit about it, is delivery, and that's true for every single, in fact, therapy, I would say, to the eye. It's certainly true for stem cell therapy, and you've heard from Dr. Gamm some of the approaches, the scaffold approach, that might be a way of basically targeting in a more homogeneous, relatively large area of the retina. So that's a really, hopefully, an elegant approach to again orient the cells properly and allow them to integrate. One of the challenges that investigators have been facing when trying to inject cells in the subretinal space, which is the space under the photoreceptor cells and between the photoreceptor cells and the retinal pigment epithelium, is that some of those cells in fact don't integrate. And that is true particularly if you are treating a retina that isn't at a stage that is advanced enough. So I think that one of the advantages that we're, I think, bringing to the table is that we have with these dog models the ability to inject these stages at stages that would be clinically relevant to those people who are basically would be in need of these cell therapies. And we know that by injecting at that stage, and that's what we've started seeing in the phase 1, is that there is a increased permeability, if you want, of the retina to these foreign cells that allow them to migrate a little bit better. So what is needed, and I think that this is what everyone's kind of major challenge now, is what I was referring to, is whether or not those cells that we're implanting are now connecting, rewiring properly, and whether that signal is making any sense, in fact, when it is sent to the visual cortex.
And then I can follow up too. So I think of this in terms of two major categories, manufacturer and installation. And William's talking about and has expertise in the installation portion of it. On the cell manufacturer end, which is kind of where I live most of the time, there are an awful lot of challenges to a cell therapy, mainly due to the fact that we're dealing with a very complex biological product, perhaps the most complex cell type in your entire body, which is the photoreceptor, as opposed to maybe a synthetic drug where it's a chemistry problem, which aren't easy, but once you solve that, you can just kind of continuously manufacture that in a factory-like setting. When it's biology and it's biology that takes many months to hit a target, there's a lot of challenges in making something along those lines. Thankfully, over the course of the last 4 or 5 years, we feel like we've solved a lot of those issues by being able to make literally billions of these cell types, to be able to highly enrich for them, almost purify them, cryopreserve them or freeze them, which is important because if it's expensive to make all of these, you can't just kind of have a 10-day window to use them all. You want to be able to store them so that makes that the economics of making these products feasible for real life individuals and not just the most wealthy in the world. And that's a very important aspect of the work that we're doing is being able to bring this to everybody and not make it some sort of designer drug that only the very, very wealthy can afford. So those are the sort of things that we've overcome to a large degree, but there are still some T's to cross and I's to dot to cross the bridge into getting it into clinics. And we're now working in what we call good manufacturing protocols and processes, which will allow us to take the products that we have and be able to introduce those into patients.
Well, thank you both so much for talking to us today. It's been really exciting hearing not only about your projects, but about your insight into this really exciting field of cell replacement therapy. And I'm really looking forward to the next couple of years hearing how the project advances.
Us as well. Yeah, we're excited to continue to work not only with FBC, but with your constituents. The folks that support you, that are indirectly supporting us, are just wonderful to talk to, and it really know it drives my lab, and I know it drives Williams as well.
Thank you very much.
Thank you.
Such a great thing. So many interesting things came out of there. And I have to say, not really related, but I just love listening to Dr. Beltran speak. He has like a wonderful voice. And after talking with him, he's also so passionate. You know, he's in veterinary medicine. He's also very passionate about his animal patients as well. So it was really a nice conversation. Thank you for that, Larissa.
It was really nice for me to hear it again, because when I'm trying to do an interview, I'm spending a lot of time thinking about the next thing I'm going to ask, to be honest. And so I often don't have a time to really absorb the words. So hearing it again, I really enjoyed that as well. I hope the rest of the audience did too.
Absolutely. And I see we have some more questions coming in, which is fantastic. So one of the questions that came in over the email, I think is quite actually related to what Dr. Gamm and Dr. Beltran were talking about. And this question came from Joe. And Joe said he's 65 years old and he has RP. And he was wondering if we think there will be a treatment or a cure to help restore his eyesight within the next 10 years, by the time he's 75, and just wondering if you could shed some insight on that.
So I actually did reach out to Dr. Gamm about this question. I felt a bit nervous about giving an answer about a timeline. Maybe that's a scientist in me. You never want to say for sure something's going to happen. But Dr. Gamm's answer was sort of verbatim: if all goes as planned, yes. But as always, there is nothing guaranteed. But if the question is, do I think there will be? Then my answer is yes. And I thought that was a great answer. I think it shows that research is happening. There's some really exciting research happening, not only in stem cell therapy that Dr. Gamm and Beltran were talking about, but in fields such as optogenetics, in prosthesis. Sort of every few weeks, every few months, there is a new clinical trial showing a bit of improvement. I also sort of want to touch a little bit on what the idea of restored vision means, though, as well, because for a lot of these trials, especially, the candidates tend to be individuals who have lost quite a lot of their vision already, partly because these are new techniques, they're slightly experimental. And so most individuals have very little vision left when they are receiving some of these treatments. And I think he mentioned within the piece that these won't necessarily be cures, but they show a lot of potential to improve vision and maybe prevent further reduction. So maybe allow meaningful improvement in mobility, more light sensitivity. For instance, there was just a study that was released about one patient who, with sort of a microchip in the visual cortex, it was a prosthesis, was able to read some letters, not all letters, but some letters. And so I think it's also, I don't want to pretend that some of these treatments are currently at the point where in 5 or 10 years we're going to see full cures or full restoration of vision, but I think we are moving towards them and improving them all the time. So I think there is a very valid hope that in the next 10 years there are some treatments that help improve quality of life, improve independence, improve some mobility.
Absolutely. And I mean, we think about where we were 10 years ago from today and what's happened in the last 10 years and how the needle keeps moving forward. I think that's important to think about as well. We've had a few questions. A couple came in over email from Fran and from Nellie asking about stem cell treatment. And so we're wondering about stem cell treatment for AMD, glaucoma. And then I also noticed in the chat, we have a question asking if there's any stem cell therapy research or trials available here in Canada yet. Could you comment a bit more on that?
So for the last question about are there stem cell trials in Canada, to my knowledge, no. I would have to double check. We do have on Fighting Blindness Canada's website, we have a list of clinical trials for a lot of inherited retinal diseases, but also listing stem cell trials for geographic atrophy, as well as some inherited retinal diseases. And to my remembrance, there aren't any that are taking place in Canada. It doesn't mean that Canadian patients might not be eligible and couldn't travel for them, but there aren't currently sites, as far as I know, in Canada. In terms of whether there will be stem cell treatments for AMD and glaucoma, Morgan? Yeah.
That's right.
So,
AMD.
yeah, so what Dr. Gamm and Beltran were focused on in their project was retinitis pigmentosa, but a lot of the work they're doing would be applicable to specifically AMD. Glaucoma is a little bit different. I'll talk about that afterwards. So Currently, there are some stem cell therapies that are being tested in clinical trials specifically for dry AMD or geographic atrophy. And this is looking at the retinal pigmentary epithelial cells, which sit underneath the photoreceptors. So Dr. Gamm's research is looking at the photoreceptors, which are the light sensing cells. And for the dry AMD stem cell therapies, they're looking at the sort of essentially support layer underneath, which are disrupted in AMD. And so there's some trials ongoing right now for that. For many individuals with wet AMD, that is often controlled with anti-VEGF. However, if there's vision loss associated with that, would stem cell therapies be applicable? I think theoretically, yes. There aren't any trials currently in place looking at individuals with wet AMD, and part of the reason might be it's a slightly more complex problem at that point because the damage would be not only to the RPE cells, but also to the photoreceptors. And that gets to something else that the scientists were talking about, was about in the future, or like even currently they're testing it out, is using sort of being able to put back RPE cells and photoreceptors together. So replace all the cells that are damaged because it's multiple cell types potentially at that point. And something we are funding right now is a researcher, Dr. Andras Naj. He is studying cell replacement therapy where the cells actually release some anti-VEGF treatment. So just an example of some of the research that is taking place out there. So I think the answer is yes, at some point there will be stem cell transplantations for AMD, possibly first for dry AMD before wet AMD. And then in terms of glaucoma, this is slightly different because the cell type that's damaged is not the photoreceptors or the RPE cells, it's the optic nerve. So it's the cells which are called retinal ganglion cells. They connect sort of the retina to the brain. So they're sort of this long transmission line. And when there is high pressure, those cells get damaged and that transmission line gets damaged and broken. So to my understanding, the work in stem cell treatments for optic nerve damage aren't quite as far advanced, but there's definitely a lot of research happening, both for glaucoma, but all types of optic nerve damage. So a regenerative therapy that could treat optic nerve damage for glaucoma could also be applicable to many other types of optic nerve damage. So there's also sort of two types of ways stem cells could be used for optic nerve. One is a neuroprotective treatment. So there is definitely a lot of research happening using stem cells, but also other techniques to try to get the cells that are remaining to survive longer. And then if those cells have been sort of permanently damaged, restorative treatments to try to regenerate those cells, which are, I would say, a little bit further behind the neuroprotective treatments. And most of these studies are currently in either animal studies or preclinical work. They're not currently in clinical trials.
And then, we've had a few other questions too about glaucoma. So Bridget sent in a question asking about, is there anything that can currently be done for advanced glaucoma, or are there research studies that she could find out more about or join?
So I think a lot of what I said above relates to this. There is a lot of research testing out either new medications, so anti-pressure lowering drops, or new surgical techniques, including some such as MIGs, which are supposed to be less invasive. And so many different techniques to reduce intraocular pressure. If in terms of how advanced your glaucoma is, it's at the stage where the optic nerve is very heavily damaged and you've lost a lot of sight, then you would be looking at restorative techniques. And that would include things such as the neuroprotective or stem cell replacement, which are very much at the research phase. Optogenetic techniques could also be potentially used, as well as prosthesis. So those are sort of the three categories. Prosthesis, some of those are in clinical trials right now. Optogenetics, there are some optogenetics in clinical trials, although I'm not too sure if the ones that are in clinical trials would be applicable to somebody who's glaucoma compared to somebody, say, who has retinitis pigmentosa. But those are, if not in clinical trials, at preclinical stages for a lot of these diseases.
You mentioned previously about prosthesis. We had a question from Salah asking about bionic eye implants, and was wondering, are there any developments in this research here in Canada? Is it still pending? Do we know the current state of the bionic eye implant?
this is the information I have. There could be some community members who have a bit more, so feel free to share. But there are a couple of, there's one, Argus, or the Argus 2, which is approved in Canada for use, and that is a retinal prosthesis specifically, and specifically in Canada for retinitis pigmentosa. And so I would say it has had limited success. And when I say limited, I don't mean that it doesn't work. It's just that the improvements are, they occur, but they are small, they're modest. So you might, somebody who is using a prosthesis might have improved mobility, improved ability to orient themselves, but it isn't a cure. They aren't getting back full sight. There is also, and we reported this in e-news, I think last month, which is why I remember this. It was a really interesting joint Spanish-American study where microchip was placed in the visual cortex, and that's the part of the brain that processes visual information, and it was paired with some glasses that had a video camera attached. And the person had damage to their optic nerve, I believe, and they had had no light perception for 16 years. And after some training, they actually were able to identify some letters. Interestingly, they couldn't identify all letters all the time, so it was limited, but they were able to play a video game. They had improved mobility. And there are different types of prosthesis. You will have retinal prosthesis, which are, if you have, that would be trying to stimulate sort of the retina. Epiretinal, which could stimulate the optic nerve, and then you have these visual cortex prosthesis. So a whole bunch of different ones, and researchers are testing out magnetic stimulation, nanoparticles, very active area of research. So far, though, there has been, I read somewhere the idea that there's limited spatial resolution. So you can get maybe some ability to see some objects, but you're not going to see it as clearly, potentially, as maybe some people would like. And there's always the worry that the impact of surgery, that there could be tissue damage. So that might potentially limit how far this technique can expand. And then there is the whole idea of optogenetics, which is turning non-light sensing cells, light sensing, and when those are paired with goggles or some other, so like usually video camera goggles, it's not a prosthesis per se, but it's sort of taking that to another level in a way. So I think it's like sort of the next generation potentially, and we're going to be hearing more and more about optogenetics.
That's great. And stay tuned, little sneak peek. Hopefully next year we'll be having a viewpoint on that very topic. Mm-hmm. So hopefully we'll have more for you in the new year on optogenetics. So, every time we do a webinar, we always get, especially if it's related to inherited retinal disease, we always get lots of questions from people, and including Mal, Valerie, Jyotsna. I think there was someone in the chat, Kathy, asking sort of about, are there upcoming treatments or trials for very specific gene mutations? So ones that have been mentioned were ICGB1, USH2A, and then of course things associated with Stargardt's, Leber's, RP. So I know we don't have time, unfortunately, to delve into every single gene mutation, unfortunately, but how can people find out more specific information about what could be available for their gene mutation or their disease?
So in terms of clinical trials, I think there are two sources, and I think a good starting point is our website. So on fightingblindness.ca, if you go to the under eye diseases or eye health, sorry, there's a innovative treatment and clinical trial section, and we have a list of clinical trials. We unfortunately can't list clinical trials for every single eye disease, but we do think that we have, if not all, almost every clinical trial that is taking place for inherited retinal diseases that are phase 1, phase 2, or phase 3. We don't currently have natural history studies, as well as stem cell therapies or gene therapies for other eye diseases such as AMD. So if you go there, it's categorized by disease. So achromatopsia, Usher syndrome, retinitis pigmentosa, and then we list every single trial. And from there, you can link out to clinicaltrials.gov, which is the second resource. So clinicaltrials.gov is an amazing resource. It can be a little bit hard to navigate, but it is really, really comprehensive. So on it, you can put in the gene potentially that you're interested in, or the disease, or the country, so you can sort of mix and match the information, and it will come up with all of the clinical trials. And it takes a little bit of searching to like go through them, figure out what could be applicable, what is open. But that information is there, and some things that you might want to look at when you're looking at a clinical trial is looking to see who the sponsors are. Is it either a well-known reputable institution? Is it a reputable company? You should never be paying for a clinical trial for sure. the sponsors, if it is a reputable clinical trial, the sponsors will pay for you. You should always talk to your doctor before signing up for a clinical trial. But also on that information, it will tell you things such as like, what is the inclusion criteria? So in clinical trials, they often try to keep the inclusion criteria a bit narrow because they want to make sure that they can see an effect. So it doesn't mean that because a trial is only for retinitis pigmentosa, that in the future, it might not be available to you, for instance, for a stem cell or more universal treatment. But there's a lot of information on that page. And if you've got any questions, please feel free to get in contact with our health information line. They can help you decipher some of the information around that. But just off the top of my head, there are some trials for USH2A happening. There are a lot of trials for retinitis pigmentosa. Some of them are gene specific, some of them are not gene specific. I do not believe I've heard of anything for ICBGB1. It doesn't mean there aren't more coming, but currently not active. Oh, last plug, sign up for our e-newsletter. I'm sure most people are, but we do try to share information about new clinical trials and results from clinical trials as well.
Yeah, absolutely. And I will say that the clinical trial page is fairly new. It's just been kind of revamped, updated. So even if you visited it in the past, definitely check it out because it has been all updated and a lot of great information on there for sure. It is a very complicated world to try to navigate. So hopefully that helps make your journey a little bit simpler in trying to figure out how that all works. So Larissa, you've been talking a lot. I'm going to give you a little bit of a break, take a breather. And I just wanted to share some exciting news for everyone in our community. You know, we often get questions about how people can support us at Fighting Blindness Canada, and Doug's going to come on in a few minutes and talk a little bit about that. But in addition to, obviously helping us support and fund vision research, we also have other programs at Fighting Blindness Canada. And one of those programs is our Young Leaders program. And this year, we've sort of taken COVID as an opportunity to try some new things, figure out how to navigate this digital world where we can't get together in person. And we piloted over this past year our Young Leaders Mentorship program. And this program is pairing our young leaders with community volunteers who are living with vision loss to help offer support and encouragement in one-on-one sessions over the year to really help our mentees develop their skills, improve their confidence, and learn from their mentors' experiences. And so this past year, we had 5 pairs go through this program, and it's been such a wonderful experience for all of us. And I have a little video I want to show you with some of the things that our mentors and mentees shared about their experience this year. And of course, I want to plug for next year. We are also running this program. We're hoping to expand it, but that means we need your help. We need your support. So if you're interested in being a mentor, or you know someone or are someone who'd be interested in being a mentee, please check out our website under our Young Leaders Mentorship Program, or you can email me at that education@fightingblindness.ca email. It's a really great experience, and I hope some of you will consider joining us. So it's just a little short video, but it's a really nice little peek into the program this year. So I'm going to share that with you now.
Participating in this mentorship program has had many significant impacts on my life. One thing that really stands out to me was my mentor helped me realize that I need to find an employer that sees my disability as an asset rather than something that needs to be overcome.
For me, it's been really nice to just make a really solid connection with someone who's kind of gone through the same thing. At the same time, there's always the visual impairment as well. It's nice to see someone who really has felt what I have felt.
So getting to know Robin over the past 6 months has made me a lot more confident in talking to people at work about some of the unique challenges that I face as a person living with vision loss.
So I was very fortunate to be partnered up with Mary Kate. And Mary Kate's an exceptionally bright and I think gifted young professional. And I think our skill sets were well matched. We think very differently, but the direction that she wanted to go and the things that Mary Kate wants to do align very much with my own sort of passions.
What's unique about Fighting Blindness Canada's mentorship program from other programs that I've gone to in the past is you're paired with someone with a visual impairment, and I think that ultimately just breaks so many barriers down in the conversation. You have so many opportunities to just talk freely, deal with different things, and sometimes somebody like myself might see a certain situation differently than someone with vision would.
I think seeing Hamid's journey through his eyes really made me reflect on my journey, particularly with the eye disease, and it gave me a greater appreciation for what I had accomplished in the last number of years.
I think mentorship is important because I don't think there's anything else that can replace that one-to-one connection that you have with your mentor or your mentee.
There's an expression that's used, an old saying that the master becomes the student as the student becomes the master. And there is such an exchange of information that takes place in a mentoring program.
Often people with disabilities, we tend to be more resilient and adaptable, and thanks to the comments of my mentor, I'm able to see that now.
Fighting Blindness Canada mentorship program really gives us that unique perspective of others who live through similar situations that we have.
I can't think of anybody that would not get something very profound out of this experience. If you approach it with a real open-mindedness and an open-heartedness, then you're going to get way more out of it than the time you put in. It's a spectacular experience. I really, really enjoyed it and could not recommend it enough for anybody.
To learn more about the Fighting Blindness Canada mentorship program, please visit us online at fightingblindness.ca.
So I hope you enjoyed that. It was such a lovely experience working with everyone who took part in the program this year. And again, please do consider reaching out if you'd be interested in learning more. All right, so giving Larissa another little minute to take a breather, I'm going to invite our president and CEO, Doug Earle, to join us for a moment to talk about some of the ways that you can give back to FBC if you're interested. And also, I think you might have a little giveaway too. Let's see. Doug, are you there?
It would help if I turn on all the
there we go.
There. So thank you, Morgan, and hello everyone. I wish you just the best of the season as we're approaching the end of the year. So I understand that there's over 150 people registered for the webinar. That's fantastic. And of course, there's so many people that watch the webinars afterwards on YouTube that we touch so many people across the country, providing the latest and greatest information about the research as today's program is about. So thank you for joining us today, and thank everyone who has supported Fighting Blindness Canada. I'm just amazed listening to the session today. Isn't it amazing listening to Larissa's answers, really summing up to this amazing moment in time for vision research, and hearing from Drs. Gamm and Beltran about their groundbreaking research into a stem cell therapy to restore photoreceptors. Clearly, lab discoveries are moving forward into new human treatments that are reaching clinical trials. That's just such an amazing moment. And when I started, it's hard to believe, 3 years ago, we were excited because we were tracking about 20 clinical trials at the time for an inherited retinal diseases. And now that number is over 70, and I'm including natural history studies in that. And you know, there are hundreds of trials for AMD, the age-related macular degeneration, glaucoma, diabetes-related vision loss, and more. This is a very special moment in time, and it's been made possible in part because of the generous gifts that people have made to Fighting Blindness Canada, that we've been able to invest in these groundbreaking research. You know, it was our patient registry that sent 5 Canadians down to Philadelphia to be a part of that RPE 65 phase 1 safety trial. And you know, now fast forward, Health Canada approved that first gene therapy treatment for an inherited retinal disease. And we're just working hard, of course, as Larissa mentioned, to make sure that people can have access to that treatment as well through Luxterna.ca. So given this wonderful time of year, given the impact that we want to have with vision research, we are right now active in our year-end campaign until December 31st. And any amount of a gift, every gift makes a difference. And I want to make a special thank you to the anonymous donor that had offered to match all of the gifts up to $40,000 with. So really, you're doubling your impact if you could spare and the time and make a gift to us. So at fightingblindness.ca is the website, or you can call 1-800-461-3331. That's 1-800-461-3331 to make your gift. And as was said, we have a special gift from Purdy's. They've actually developed, they've got Braille now on this special box in order to help the community enjoy Purdy's chocolates. So if you fill out the survey today for this event, we'll be sending you this box of chocolates, and you can check out the Braille that they've done to make it more accessible to enjoy Purdy's. Just a little special year-end gift, and we really value your feedback. It's a bit of a way of us saying thank you. So again, thank you for investing in Fighting Blindness Canada. We are so grateful. And from all of us at Fighting Blindness Canada, we wish you the best, very happy, healthy holiday season. Thank you, Morgan.
Thank you, Doug. Box of chocolates look good. I've heard.
You don't know how hard it is for me not to open it.
I know. I've heard a lot about these boxes over the past few weeks. It's like blowing up in my social media, which is so fantastic. And my partner, he works in the field as well. He's been looking all over Toronto for them. Apparently, they're only at one store in Toronto, but you can get them online. So I think it's a great initiative, and we definitely want to
just fill out that survey and give us your feedback.
Exactly. So make sure you fill out your survey at the end, and we'll do a draw, and one lucky winner will be getting that yummy box of chocolates as well. So we have maybe about 20 minutes left. Sorry, Doug, I'm gonna move you over here. And Larissa, how are you feeling? You ready to answer a few more questions?
I'm ready. I feel like this will be, like lightning round, try to get through some quick answers.
Excellent. Okay, so I have one last question here from Doris. It came over by email. It's about the FBC patient registry, which I think you mentioned a little bit earlier. So, Doris is just asking, how often do researchers consult this registry? Are people who are in the registry contacted about being in clinical trials? And is it an international database? Is it just Canadian? Can you tell us a bit more about the patient registry?
Yeah, absolutely. So the patient registry, it's for inherited retinal diseases, and currently it is for Canadian patients. We have 5 sites in Vancouver, Edmonton, Toronto, Halifax, and Montreal, Montreal being the most recent. However, if you don't live in one of those cities, if you don't go to one of those sites, you can always enter by, if you can't go through our website, we will give you the forms that you need to fill in to give us consent to enter your data into the patient registry. So the patient registry, there's a few really big things that make it important. It is definitely used by researchers. So definitely the researchers who are part of the registry, who are some of the top IRD specialists in the country. So they are the ones who are being contacted by all the companies to be part of clinical trials. So this really helps them be able to contact patients quicker if a treatment or a potential trial is opening. And then secondly, we definitely have interest from pharma companies and biotech companies who are interested in starting up clinical trials and want to know, are there patients in Canada? And so this information helps us tell them, yes, there are patients here. We sort of know who they are. So if you set up a site in Canada, it will be easier to recruit them. And just in the 2 years that I've been at FBC, there have been quite a few new trials that have not started, will be starting in Canada. And I think it's thanks to the registry and thanks to all the individual researchers and scientists who are working so hard on the registry. So if anybody has an inherited retinal disease and is not part of the registry yet, please go to our website, again, I always say this, Morgan's going to send you the links. Morgan's sending you the links to everything. But go find out what information you need. And if you don't have genetic testing yet, that's the first step. You can join the registry without your genetic testing, but having your genetic testing, especially for some of the gene-specific trials that are out there, it is very important as well.
Absolutely. Okay, great. So let's look at some of the questions that are coming in through the Q&A. And of course, I'm going to have our little disclaimer, like neither Larissa or I are clinicians, so we can't necessarily answer some of the very clinical questions, but we'll do our best. So there's a question here from Bharat, who is asking, what's the latest developments in research for dry AMD? And we talk about wet AMD a lot, but what's going on these days with dry AMD?
Yeah, actually, there's quite a bit happening for dry AMD, and I would say specifically for geographic atrophy. So geographic atrophy is the advanced form of dry AMD, which is where a lot of the vision loss associated with dry AMD can occur. So there's a number of different clinical trials. Some of them are drug treatments. There are stem cell treatments. So there's even gene therapy treatments that are all in clinical trials. The latest or the most recent that I heard was from a company called Apellis, which is testing out a treatment called Pegcetoplan, I think. It's a long word, something along those lines. It went through phase 3 clinical trials. It saw there were 2 sort of trials back to back, and one of them they had significant results. In the second one, the results weren't significant, but together the results were significant. And I know they are looking to try to get it approved in the States with the FDA first. And so if successful, I think they will then be moving around the world. So that is exciting because it will be one of the first treatments for dry AMD. But it's an area of really intense study right now, because for wet AMD, we always talk a lot about anti-VEGFs. That is a treatment out there. It doesn't work for everybody, but it has been extremely successful for many people. But for dry AMD, especially geographic atrophy, there's still a bit of there's a space, there's a need, a definite need there.
Absolutely. And hopefully in February, again, I'm just going to give a little plug there, next year, we always usually try to raise awareness for AMD month, and we're going to be having a viewpoint on AMD, and hopefully we'll have some more to report about what's going on in the dry AMD space at that time as well. I have another question here from Marie. It's a follow-up question from Dr. Gamm and Dr. Beltran. And so Marie says, in the stem cell therapy described, would tissue rejection not be a potential problem if stem cells from a donor other than the patient were used?
Mm-hmm. This is definitely something the researchers are considering. So for one of the big parts of the first phase of the study that Dr. Gamm and Beltran were doing was actually trying to develop an immunosuppression protocol. This is for dogs, but it's a really important part of the transplantation, because you're right, if you're injecting in cells that are not self, there is a risk of injection. In the eye, there is potentially a lower risk of it. The eye is considered to be an organ that is immune privileged, where there are less immune cells. It doesn't mean there aren't any immune cells in there. It doesn't mean inflammation can't happen, but there are less immune cells and it is less likely to happen. So the amount of immunosuppression you would need would probably be lower. So immunosuppression would probably go hand in hand with the stem cell treatment. And the question, I guess, would be, and that's definitely a topic as any of these start moving into clinical trials, is how long would immunosuppression protocols have to last for? Could it only be for a few months or a few years, or would it have to be more of a chronic or a lifelong thing? But yes, there is the risk of it.
And then there was another follow-up here, if I can find it, about Dr. Gamm and Dr. Beltran's work. So I think she says, I don't know if this one is too specific, Larissa. Maybe we can reach out to Dr. Gamm if we can't get the answer here. But so she says, it's from Tina, most HESC or iPSC derived cell lines, including the HRPE line and the photoreceptor line, the technical bottleneck lies at cell biological competence. And she's wondering about genotype and phenotype protein profiling of the cell lines in comparison with native young RPE or photo R cells.
Mm-hmm. So I think I'll give maybe a high level answer, because I'm not the researcher, but I think the Tina is asking, like, I would say, well, yeah, definitely one of the bottlenecks is, so you're putting these cells in, they develop into photoreceptors. Are they actually functional photoreceptors, or are they just cells that are sitting there and don't actually, maybe they aren't fully photoreceptors? So that is an absolutely big question in the field. So I don't know necessarily if they are genotyping in the eye, but I do know that they are testing using something called immunohistochemistry. So in the animal models, they take the retinas and then they stain them with different markers of photoreceptors. So they want to make sure that they have developed fully into photoreceptors. And that is definitely going to be a big part of the experiments going forward. So is vision improved, but also what is the functional characteristics of the cells?
Great, thank you. We have another question here from Bill. And Bill says, it's well known that in the retinas of many common telosts, which are bony fish, such as goldfish and zebrafish, new rod photoreceptors are added throughout their life. These new rods are integrated seamlessly into the retinal circuitry. So wouldn't it be useful to study such animal models to learn what molecular and cellular mechanisms make this possible, and then incorporate those into these cell replacement protocols? It's a great question.
Yes, and absolutely. I would say there are definitely researchers out there who are looking at that exact question, because it's a really interesting phenomenon that in some animals, their retinal cells can regenerate. So photoreceptors, their other cells called glial cells, which can turn into other retinal cells. And so they have much more regenerative capacity than human cells, which do not regenerate. So scientists are definitely looking to understand what is it that makes them regenerate, and can we take that information and bring it over to other animals or to human studies. I don't think right now they haven't found exactly the sort of 1 or 2 genes that can turn the switch, but it's definitely an active area of research.
Great. And then I remember hearing about glaucoma research into zebrafish, and I never knew what a zebrafish was. And I looked it up, and they're fascinating creatures. It's kind of a cool thing. We have another question here from someone who's asking, saying they're part of a patient group with myopic macular degeneration. And do you plan to, or do we sponsor any research into that particular condition?
So we don't have any research currently that is specific for myopic macular degeneration, although a lot of the research we are funding, whether it's about potentially stem cell research, other universal treatments such as optogenetics could apply. But as an organization, our mission, as many people know, has expanded to include all types of blinding eye diseases. So we are definitely open to funding research across the spectrum of eye diseases. So just this year, we had a research call where we asked Canadian scientists to put in their applications for what they thought was the best and most promising research. We have, they went through a big review process, and we're actually going to be announcing it in January. So I'm very excited to discuss that. And what I can say is we are funding in many different types of eye diseases. So front of the eye, back of the eye, so across the board. So it is open to all different types, but currently we're not specifically funding that eye disease.
Okay, we have another question here from Marie Jose, who's asking, are researchers around the world talking to each other and comparing information about their research? And this is an interesting question. And recently we spoke with the chair of our scientific advisory board, Dr. Michelle Kaiwet, who talked about this. I'm sure you can paraphrase a lot better than I can. Larissa, do you want to tackle that?
Yeah, no, sure. I'm actually just going to try to remember exactly what Michelle said and tell it back, because he had a great answer. So his answer was yes, they're definitely talking about it. That is one, researchers love sharing and learning from other researchers. So they go to conferences, they publish papers which are open to all scientists. So it's really, really important to them to both learn from other scientists, but then also to share the work when it's done. So they also have collaborations with each other. So for instance, in some of the research we fund, some people are collaborating within their own institution in the same city, but sometimes they're collaborating across the country or even internationally. So as the scientists go to different conferences, they meet other scientists who are working on similar topics and say, oh, that's a really interesting animal model. Maybe I can borrow that. And the scientists will also, when somebody publishes something, they actually have to share all their reagents. So if somebody makes a really new, interesting animal model, as soon as it's published, the way I'm saying this as if it's a law, like there's no such thing as a law, but like it's just sort of one of those rules where you have to share it. So somebody will then just write to you and say, can I have this? And you will send them a small amount of it. You will arrange to have an animal transferred. So the actual reagents actually get shared too. It's not just the knowledge, it's the actual tools also get shared internationally.
Yeah, I think the sense that I got, after we spoke to Dr. Kaiwet about that was just this lovely spirit of collaboration, right? We're all working towards similar goals here, and people want to learn from each other and hear what other people are doing. And that was one of the big things about COVID that they said has been disappointing, is that a lot of these in-person meetings have been canceled. So, a lot of hope, and we're excited about those things coming back and being able to get together in person and learning and sharing with each other over hopefully the next year. There's a few more questions here. I'm not sure, Larissa, some of them might be a bit specific. Can you see the questions? Are there any there that you feel like we could give a good answer to? I mean, I know there's some questions about side effects of Eylea, which I think might be a bit more of a clinical question. Definitely, I would recommend, talking to your doctor about that one. There's one here about Dr. Gamm's project about slowing the progression of best vitelliform macular dystrophy, which they previously reported. Are you familiar with that component of their work?
I don't know about that component of their work. So no, I don't know if there's a different project. I would say this project, it could have applicability to it. Especially with the scaffolding, if they're able to replace both the RPE cells as well as the photoreceptor cells. But unfortunately, I don't know about that specific project, so I don't want to comment on it.
For sure. And then we had a question here from Stephanie about, there's a specialist in Quebec that's been sending patients for acupuncture trials with RP and Leber's. Have you heard of that one? I don't know anything specific about that one at this time.
Yeah. I don't know about that specific trial, but I have heard about studies about RP and acupuncture. From my understanding, I might be wrong, but there isn't a very clear, it's not like clear that it significantly improves vision, but I think there's maybe some positive effects, but then other studies there isn't. So I don't think the data is there yet. I would say the first thing to be considering when you're doing something like acupuncture is there any risk of harm? If the answer is no, if it makes you feel better, like I'm not sure if the acupuncture is actually being taken place in the eye or if it's other parts of the body, and if it's like helping to relax. So I don't want to get too far into my comfort zone here, but if after talking to your doctor there are no harms to it, I think the placebo effect is real as well. And so if something gives you a better quality of life, makes you feel better, as long as it's not harmful, it's a very valid thing to try out.
Absolutely.
But the data is not there, I think.
Early stage. Yeah. Okay, and then the last question that we have here in the Q&A was from Donna and John, and they're saying it seems that focus is on cures after the disease has progressed. Any programs to support study or study supplement efficacy? So, for example, lutein, fish oil, greens, that sort of thing. And we've heard a lot about vitamins for certain conditions like AMD, for example. Do you want to comment on that?
Yeah. So I'm not certain, but I feel like they might be also referring to, there are a group of vitamins called ARADs, which if you have advanced dry AMD, there's some, or moderate to advanced, there's some evidence that ARADs, taking this supplemental mix of vitamins, can reduce the progression. And there are different types of combinations of the vitamins. There's sort of a base one, and then you can add in things. And there is a lot of, I would say, not necessarily controversy, but there isn't very clear data. But if some of these extra components are useful, in some cases, are they actually causing harm in other ways? The data is a little bit unclear about it. I would think with a lot of supplement research, it's very complicated research to do well, because you need the effects are extremely, extremely small. So you need really, really large sample groups. So often you'll have one study with like maybe 60 people or 100 people and saying, oh yeah, we saw an effect. But as soon as they open up the study to more people, the effect goes away. So I think that is part of the reason why there's so much confusion, is because it's really expensive and really hard to do large studies. The ARAD study, the reason everybody talks about it is because it was an extremely large study, and it's hard to do that work again. So in terms of us doing that research, or funding that research. We were always open to funding research across epidemiology. I think epidemiology is so exciting and so interesting, but it is complicated, really hard. Like everything, one day somebody's telling you that red wine is good for you, another day, to be honest, alcohol generally not so great, or chocolate's good for you, chocolate's not good for you. I think it just gets down to the complexity of studying nutrients and then specifically taking like a supplement out of it. It's very, very hard work. It's a lot of questions.
Yeah, and I feel a little bit like a broken record today, but of course it's something to discuss with your doctor about your specific situation, because, the areas, for example, is a formula. So there's lots of different vitamins in there. If you have other health conditions, if you're taking other medications, there could be interactions there. So always just best to talk to your doctor specifically about taking them. But thank you, Larissa. That was fantastic. And thank you everyone for sending in all those questions. I think our timing has worked out perfectly. We are just about at 4:30 here, so I'm going to let everyone go and enjoy the rest of your day. I